All right, so let's get started. I'm Dr. Mele. This is Turning Up the Heat, Detoxing with Infrared Sauna Therapy. So what is infrared sauna therapy? What conditions can benefit from treatment? Contraindications, meaning who shouldn't do infrared sauna therapy? Any indications that you should speak to a physician about before. Its role in detoxification, some current research, and how to incorporate this into your treatment and lifestyle. So that's everything that we'll be going over. So first, what is infrared sauna therapy? So I just kind of want to direct your attention to this image. This is what an infrared sauna looks like. So most of them are made out of cedar. Um, the one that we have in the clinic is made out of cedar. And it uses infrared lamps and infrared light. So this is different than a dry sauna. What a dry sauna does is that it heats the air around you. So you get hot and you sweat because you're surrounded by air that is very hot. An infrared sauna, with the light, heats the body directly. So this is very different than a dry sauna. It's able to penetrate more deeply into the tissues and offering more benefits. The temperature usually gets higher in an infrared sauna, usually around 150. We usually start ours at 125. Ours has a bench inside. Usually you can wear a bathing suit or you could just be nude with towels. Um, if you have any mobility challenges, it's just a small step into the sauna, and then there is a place to sit. We can always help if that's a challenge as well. Infrared light has a wavelength that's just greater than that of the red end of the visible light spectrum, but less than that of microwaves. So we'll kind of look at that on the next page. So maybe we've all learned this a long time ago in our chemistry class, but this is the visible light spectrum. So I want to bring this back to that infrared sauna is using this infrared light to heat, warm the body, and do these amazing healing benefits. This is because we're using the frequency of the light. All light has frequency. Frequency is incredibly healing to the body. We've known this for centuries, years, many, many, many years. Music has frequency, light has frequency. All of these things are very healing to the body. Our cells, our body is mostly composed of water. Water likes to interact with light and heat. It can create change. It can reorganize cellular patterns. So please remember that this is how that treatment is healing to the body. So if we can see here, we just see that this is the visible light spectrum. These are the nanometers of color that we can see. We have UV below that, then we have infrared right above that. So that's what the sauna is using. So how does it work in the body? What is the mechanism? So we talked a little bit about how the light heats the internal body temperature and causes a sweat response. So again, we're heating the body. The physiologic compensatory response is to create sweat. So when our body is heated also, our blood vessels dilate, they get larger. They're compensating for more blood being pumped throughout the system. The circulation is increased. So that's why, if we're Caucasian, we might see red or pink color. If we're African American or Indian, we might see a more violaceous color to the skin because that blood is up close to the surface. We're getting more oxygen and nutrients to the tissues. We're able to, if we have an injury, something, maybe we broke our leg, we have a scar, we have a joint replacement, that area probably has some scar tissue and is probably inflamed. So we need that oxygen, nutrients in that area so that it can heal. Infrared helps to do that. It's going to help to remove and clear what isn't needed. It's going to cause an increase in the heart rate. So again, body's pumping more blood, circulation's increasing, the heart rate increases to compensate for all of that. It increases cellular function by stimulating mitochondria. So these are the energy centers of the cell in the body. So we are stimulating that energy production, that main energy producer, as well as cellular respiration. So this is the main process that the cells go through to make energy in the body. This happens thousands and thousands of times per day. Also helps with glucose transport. We'll talk about that a little bit more later. Heat shock proteins and hormesis. So hormesis is this evolutionary concept that if we put the body under a mild stress, that can actually be beneficial, can help to upregulate cellular function, help to uprate cellular metabolism. So, we want the body to be exposed to healthy stresses so that it can learn to adapt and compensate. If we don't if we are kind of exposed to too large or too long of a stress event, say, for example, that it's very cold in Flagstaff right now. If you went and you stood outside all night in a t-shirt and shorts, that's a big stress on the body. It's having to warm itself, go through all those compensatory mechanisms. That's not a healthy stress. That is an unhealthy stress. So what conditions might benefit? So any cardiovascular condition, pretty much. Heart failure has a lot of research behind it. Hypertension or high blood pressure, presence of any cardiovascular risk factors. So cardiovascular risk factors are things like if you have a first-degree family member that had an early heart attack or stroke, meaning like before the age of 50. If you have sleep problems, that's a cardiovascular risk factor. If you consume alcohol, if you consume tobacco products, if you already have high cholesterol, if you have hypertension, if you have sleep apnea, all of these things can be benefited by infrared. COPD, chronic obstructive pulmonary disorder, elevated cholesterol, metabolic problems, so prediabetes, diabetes, issues with blood sugar control, obesity, whether that's chronic or acute, insulin resistance. So that's kind of a buzzword that's thrown out a lot. What does that mean? So basically, when we're intaking a meal that's broken down, glucose in the blood rises. We need to release insulin to be able to bring that glucose into the cell to be used. If we constantly have high blood sugar, our insulin has just been thrown out, that the body no longer has sensitivity to when it needs to release insulin and when it doesn't. Infrared can help to re-regulate that process. Somebody has exercise intolerance. So again, maybe we have conditions where we've had a knee replacement or we have had a lot of injuries from sports or other things, and it's really difficult to exercise due to pain or mobility problems. Sauna puts a similar physiologic stress to exercise on the body. Endocrine disorders, so diseases of the thyroid, hormonal dysfunction of any kind, environmental toxicity. We're all bombarded by things in our environment on a daily basis. It's helpful to do something that gently detoxifies the body so that we can help to clear the body of any unwanted or unneeded toxins. Neurologic conditions, so things like dementia, Alzheimer's, loss of memory, loss of cognition, even early signs of losing cognition. So maybe our memory or recall isn't as good. We're forgetting things we haven't before. Maybe we're having some trouble with word finding, kind of searching for words. They don't come as easily. Things like chronic pain conditions, weakness. So that might just be general weakness, muscle weakness, progressive weakness, fatigue and chronic fatigue syndrome. There's a lot of good research supporting that. Fibromyalgia, so this is a condition where there's a lot of soreness and tenderness to muscles and joints. It's used a lot for sports recovery. So after, large expenditures, maybe things like a marathon or triathlon, or, even if you just spent the day skiing or something like that. Skin conditions. So I put a star next to this one because some skin conditions cause photosensitivity, meaning they're worsened by light exposure. That's typically things like lupus. That would be a good one to talk with your doctor about to see if being exposed to the infrared light might not be beneficial. Depression and anxiety, some mental health disorders as well. Contraindications. So basically that means you should have a conversation with your doctor before participating in infrared sauna. Hemophilia, this is a genetic blood condition. It can cause some heat sensitivity, so you'll want to check with that. Typically, this would be diagnosed very early on, or a family member would have it and you would have received genetic testing at a younger age. Chronic alcohol and drug use. So I don't mean a casual daily use like a glass of wine per day. I mean chronic alcohol abuse and drug use. Chronic use of alcohol and drugs, it depresses the respiratory centers in the body. So can make us more prone to fainting, can also institute an arrhythmia or irregular heart rate. So again, the risk there would be with somebody fainting, going in or having a heart attack or stroke. Medications. So these are all common medications that you'd want to discuss if you're on them. Diuretics, if you're on those things for heart failure, kidney problems, high blood pressure, barbiturates, not prescribed as much anymore, but for psychological disorders. Beta blockers typically prescribed for any arrhythmia, AFib, hypertension. Anticholinergics typically prescribed for pain syndromes or in an acute setting. And then anticoagulants or blood thinners. So if you have clotting issues or if you had a heart attack or stroke. Undiagnosed arrhythmia, so if you have a heart rate irregularity that has not been diagnosed. Low blood pressure, so I mean really low, like top number is less than 90. You know, if you're usually 110 over whatever, that's really not a problem. Any condition that has heat sensitivity, things like postural orthostatic tachycardia syndrome or lupus. I have had patients with these conditions do just fine with the infrared, but again, a conversation is worth having. Contraindicated in pregnancy, for newborns, recent trauma or surgery. I put a star by this one because it depends on the type of trauma or surgery. And then heart transplant would be contraindicated. A question that came up in the live webinar was, what about things like breast implants? Any body modification or plastic surgery is not a contraindication. So its role in detoxification. So what is actually going on to promote detoxification in the body so that we're in meeting, you know, we're purifying, we're clearing something from the body that's not favorable for the body's response. So it helps to excrete water-soluble toxins. So again, we talked before about sweat. It's increasing the sweat response. We're clearing things that are soluble within sweat. Things like heavy metals, pharmaceutical drugs, environmental pollutants, things we're all exposed to. It helps to increase cellular health and function. So those hormesis mechanisms helping to upregulate that cellular metabolism. Improving oxygenation to tissues. So again, increasing circulation, bringing oxygen to the area. For a cell to be healthy, we have to be able to clear waste products effectively. If we're not doing that, those cells are not going to rejuvenate as quickly. They're not going to have as healthy structure and function. Increasing exercise tolerance. So if we're able to exercise more, we're able to easily more move our lymph fluid, mobilize toxins. Aiding organs of elimination. So what's our most important organ of elimination? Our skin. So of course, this is a direct stimulation of the skin via the infrared light. So our other organs of elimination would be our kidneys. We're excreting urine. That's a waste product. Our lungs, our respiratory tract, we're excreting waste products there that the body doesn't need. Our gastrointestinal tract via bowel movements. We get rid of a lot of body waste that way. So any of these things that we call elimination organs, they usually have a mucosal membrane. So something that helps to keep tissue integrity, keep things in that need to stay in, boot things out that need to be booted out. And that's usually through a waste product, so either a solid or a liquid. Muscle recovery. So we kind of talked about the role in sports recovery before, rejuvenating the tissues. So some recent research that is kind of related to certain conditions. I just did this talk, so I'm going to start at the bottom at a different place just to entertain myself. So heavy metal detoxification. A lot of good research confirming that there are higher sweat concentrations of toxic metals such as cadmium, arsenic, mercury. These are things that we're all exposed to on a daily basis. But if we're in certain professions or if we've lived in certain areas, we might have a higher exposure. For example, maybe you grew up in Detroit, we're part of the auto industry. Of course, you're going to have a higher exposure of heavy metals. If you've done work with cars, if you work with chemicals, if you're a chemist, if you're an engineer, if you're a technician of any sorts, you're getting more exposure. You're touching these things, you're breathing them in. Mental health. So there was a lot of good research about that. The infrared helped to reduce the appetite loss associated with depression. Often, in depression, it's very difficult to want to eat or have an appetite. Also improved depression scores across a lot of different types of populations. So we have a lot of standard metrics that we use to measure improvements in depression. So that's what that means by scores. Fatigue. So help to increase daily energy level, increase levels of endorphins. So all of those feel good chemicals. And then shifting the ANS, that stands for autonomic nervous system. We have two arms of that. So we have the sympathetic and we have the parasympathetic. Sympathetic is our fight or flight. So when you're driving the car, you skid on the ice, you know what to do, your body responds, you're in a sympathetic response, fight or flight, live or die. Don't want to be there all the time. It's not a healthy place to be. It's too much stress on the body. We want to be able to activate this arm, the parasympathetic nervous system, the relax, the rest, what's called rest and digest. When we're in healthy digestion, we're in parasympathetic mode. Can't digest our food when we're running from the bear. That's not the body's focus. So it helps to shift the autonomic nervous system into the parasympathetic response. Pain conditions. This is a big one. So it can be chronic pain, acute pain. There was a lot of different research studies where pain reduction for different concerns kind of range from 20 to 70% with consistent use. Things like weight loss. It helped to increase. This is a big issue for a lot of people, and it's kind of has two main hormones have to do with that. One is leptin, the other is ghrelin. Ghrelin, we think of that, what makes your stomach growl, G and G. So what stimulates the appetite, makes you hungry. Leptin is what says, we don't really need to eat anymore. It cuts that off. Typically, if we're having troubles with weight loss or issues with weight gain, we have leptin resistance, similar to insulin resistance. The body is just not sensitive to when it should release leptin. The infrared can help to upregulate this process and decrease that dysfunction. So you'll see this word on here a few times, endothelial function. So the endothelium is the inner lining of our cells, mostly our vasculature, so arteries and veins. And so what the infrared does is it helps to decrease inflammation and strengthen the endothelium. That's really important for healthy vascular function. So that leads to healthy lungs, healthy cardiovascular function. But if you kind of move up here and see under diabetes, it's important too, because if we constantly have high blood pressure, or excuse me, high blood sugar in the bloodstream, this is extremely irritating to the tissues, specifically the vasculature, the veins and the arteries, and specifically those very small veins and arteries. So what we call the microvasculature. So if we think of something like our brachial artery, we can all find that on our arm and we can feel it. The microvasculature is much different. Those are those small arteries and veins that are behind the eyes and that supply the eyes, that are around the kidneys, that supply the kidneys. These are very important organs. And if we have high blood glucose constantly in the system, that's extremely irritating to those structures and can cause an inflammatory response. So the infrared helps to decrease that response. And there is also some good research for diabetes too that help to improve glucose transport in and out of the cell, as well as just quality of life in patients with diabetes. So, improving things like mental health, stress. There was an interesting study that looked at a large group of men and looked at their cholesterol levels before, during, and after sauna. Found that during the infrared treatment, it helped to decrease total cholesterol, triglycerides, and increase the HDL, or the good cholesterol. Heart failure. So probably there is the most research with infrared sauna and heart failure. So when the heart fails, what does that mean? Basically, that the mechanism to pump and get blood to the system to oxidate tissues for longevity, for respiration, for function is not working very well. Either that happens due to an enlarged chamber of the heart or a thickened chamber. So, if something is very floppy and it tries to pump, that doesn't work very well. That's what the heart is trying to do. And a measure that we look at with heart failure to sense improvement is what we call left ventricular ejection fraction. So basically, how much and at what percent is that left ventricle pumping to the rest of the body? That is the main ventricle that pumps blood to the entire body to use. So we want that number to be higher. If it gets to be low, that means it's not very efficient. The protocol that has been studied the most is called the WAN protocol. So this is a Japanese protocol that includes 15 minutes of infrared sauna. Then you get out of the sauna, you're wrapped in blankets, and you're left to sit there and sweat for an additional 30 minutes. So done with consistency, this helped to improve that left ventricular ejection fraction. So treatment, how do we do this? How do we put this in our lifestyle? So 1 to 2 times per week is preferable. You can do more than that if you tolerate it. I would start at about 20 minutes. You can work up to 30 to 45 minutes. It just depends on what the body can tolerate. So again, I'm going to point you to the most important point here at the bottom. Stop if you feel lightheaded, nauseous, or faint. Don't push it. It's not a competition. You don't have to say, I have to stay in there for 30 minutes. You don't have to do that. That's not necessary. I would definitely hydrate before and after treatment. You don't want to fast, come in, you haven't had any water, you get in, you sweat out all your electrolytes and fluids, and then you don't drink any water the rest of the day. You want to replenish what is removed from the body. Electrolytes are a good thing to use along with the water. I like LMNT electrolytes or Redmond Relight. They have a higher concentration of sodium and they're really well balanced with minerals and they don't really have any crap in them like artificial flavors and colors and all that stuff. If you're treating heavy metals or you want to increase detox potential, I would talk with one of us about using binders. We do have sauna packages available for purchase. You can use them as needed, but it's really best therapy if used on a consistent basis. Cold rinse after or having a towel soaked in cold water and just brushing the limbs after will help you to get some cold exposure, which is also beneficial. And then you can dry brush after. This is kind of getting one of those like bamboo bristle body brushes that are that you lightly brush on the skin. You want to follow the lymphatic pathways after. If you have questions about that, we're happy to answer. If you can't access the sauna, doing a warm to a hot bath, even if it's just a foot bath, that'll help to activate a little bit of that hormesis and get it going. You could also purchase an infrared light or lamp. There are a lot of them available on the market. Use that 20 minutes a day, or you can use the free infrared available, which is sunlight. So daily sunlight exposure, if you want to get infrared spectrum, needs to be in the morning and the evening. That's not really present in like 12 o'clock in the afternoon. So, try to brave that weather, get out there to get your exposure. I just wanted to include that dry sauna is good too for hormesis, but it doesn't have the same cellular benefits as infrared, and we went over that earlier. Try to use this treatment as a mindfulness exercise. How often is it that you have 20 minutes where you can just kind of sit and be with yourself? You're not expected to do anything. Nobody needs you in that time. Don't need to be on your computer. You don't need to be worrying about something. So just kind of notice what the body and the mind does. Please don't bring your phone in and start mindlessly scrolling. We want to activate the body and the mind. We want to be able to absorb that frequency and let it heal the body. We want to start with trying to bring some mindfulness into that practice. We want to just kind of, maybe you get in there and you just kind of notice where the mind starts to go. Maybe you start to think about what you need to do the rest of the day, your to-do list, what do you want to cook for dinner? The more that you incorporate mindfulness, the more that that little chatter starts to just kind of drift away and you get more into deeper thoughts, a deeper state of being. that allows you to process emotions, feelings, events. Might even just allow you to have some silence with yourself and enjoy that. You are the person that you are with the most, so you might as well be able to enjoy that space and time. There is Bluetooth that can connect through the sauna. So if you want to listen to some healing frequencies, I would highly recommend that. Again, these are frequencies that are tuned to heal the body, clear negative thought patterns, incorporate self-love. We did have a question in the live webinar about, is there EMF exposure with infrared? No, there's not. It is an electromagnetic frequency, but it is a healing frequency. It is not a harmful frequency like things like Wi-Fi, cell phones, microwaves, that type of thing. So that was a good question. Here's our pricing. You can just take a look at that. I won't really go over it. One treatment is $20. You can buy a 10-pack. We do have a January special. It's a free sauna treatment with a chelation IV. And if you're signing up for the weight loss program in January, you do get a 10-pack for free. So I would suggest using that if you do that. Some references for you, some links to all the clinical studies if you just kind of want to dive in there and take a look. So next week, Dr. Paul will be discussing IV chelation therapy. You can sign up for that webinar on the website. Thank you so much. Sorry I had to re-record this for you. I hope it's still the same information. I'm trying to remember all the questions that were asked. Somebody did also ask if a higher temperature is better. Not necessarily. Go with what your body can tolerate. More is not better. Across the research, it's pretty varied between about 115 and 160. Again, we usually have the temp at 125. If you have any questions, anything comes up, please send an email or give us a call and we'll get back to you with the answer to that. Thanks so much for joining us, and we'll see you at the next webinar.